Thank you very much. I thank the Administrator for being here. I thank you, Governor, for being here. You're witnessing the kind of usual scene here in Washington where we're trying to figure out who to blame the most, but we've got a real problem. We've got a real problem. And, Governor, obviously, you've got major responsibility, and I want to focus on the solution. I mean, a lot of governors, I think, if they had this problem, they'd be out there digging trenches and replacing pipes. You have requested from the Michigan legislature a little over $200 million. Is that correct?
Yeah, $232 million, $67 million of which has already been appropriated.
All right, so you've got $67 million. Now, is it the intention in using this money, in addition to dealing with infrastructure issues, to address the health needs of these children who have been permanently injured as a result of ingesting lead in the water?
Absolutely.
Explain to me what the plan is for mental health. Explain to me what the plan is for cognitive disabilities. Explain to me what the plan is for daycare. Explain to me what the plan is to assist these parents whose kids are in their arms, are not whole like they would be, whose future is compromised, and these parents, in the midst of contending with this, have to figure out how to go to work when their kids need them at home. So my question is, if you acknowledge that those are real issues as a result of ingesting the lead, what in the $238 million is going to address those ongoing needs?
Yeah, and Congressman, what I'd say is it's worse than you stated it, in my view. I appreciate all the things, but in terms of what we're doing, in terms of physical, social, and educational well-being, of the 232, $63 million is identified that, and the program's breakdown as follows, and I apologize, the time limits. Early on is a program to help kids from birth, essentially, to have assessments a couple times a year and then have intensive follow-on services to the degree the assessments identify issues. We're talking about adding developmental child care to help kids beyond that point.
I'm going to interrupt. I appreciate it. I only have 5 minutes.
I'm sorry. I thought you asked me to
No,
answer.
I did, and I'm going to let you can submit that in writing. But here's the apprehension I have. I'm a parent, and you've got these programs you just announced. I'm trying to figure out today what I do tomorrow. And who does the parent call when things aren't working out? Who does the parent call when they're late for work because their child is having an episode? Will there be somebody answering the phone?
My commitment is to get a long-term solution to this.
All right, so let me ask you this. You've got about $1 billion in Michigan partly from a rainy day fund, right? And partly?
No, it's about $600 million, but it is a significant amount of money.
In the rainy day fund?
Yes.
And then you have some money from your surplus.
That money is also being identified for the State Water Infrastructure Fund.
All right. Let me ask you this. Let's say that when your own assessment reaches the conclusion that to meet those needs that you've acknowledged, I described them, and you said my description didn't actually fully state how bad it really is. If new revenue is required to meet the obligations to these young children years from now, but your assessment shows today that money will be needed, and it requires you to promote revenue-raising measures in order to get it, would you do that?
What we're doing already is we've identified ongoing dollars that we think are appropriate to cover the cost of those programs. But to go to your point, one of the things in particular I have in that appropriation is a $50 million reserve, because it's too soon to tell all these needs.
Yeah, but you've asked for $238 million. We don't know what it's going to cost. We just don't know. We're in the wild blue yonder here. You don't know, we don't know. Let's be fair. None of us really know. And you wish, and I'm sure as we all wish, this didn't happen. But there is an open-ended problem where we're going to be hemorrhaging lives and futures unless we really double down now. And what assurance would I have as a parent that those future and even unknown needs are going to be met if I don't have a state, through its governor, saying whatever it takes, we're going to be there?
Well, that's why I've made a commitment to get these resources start these programs with significant reserves to say, we will learn more. I appreciate your comment.
One other question. You know, I actually buy into the argument that a lot of my Republican colleagues make about local control. I think the more things are done at the local level, the better. But the request now, in your request, is the $750